Hey everyone, what's up? Dr. Charlie Johnson, physical therapist. Hope you're doing well. Appreciate you checking out this channel. In this video, I want to share with you a story of a gentleman named Joey who had been dealing with L5, S1 disc herniation or L4, L5 disc herniation. I think he had both levels. Back in 2022, he had these disc herniations occur, and now he's having a flare-up for the past month and a half or so. So I want to share with you the thought process that Joey went through and that we sort of taught to him so that he could get relief as quickly as possible. Real quick, for those of you who do not know me, again, my name is Dr. Charlie. I'm a PT. I have my orthopedic board specialty, and I specialize in helping people with back, butt, and sciatica problems all over the world. So if at any point you're watching this and you're like, hey, this sort of makes sense. This is a different way to go about solving this problem. It would be great to actually learn what I need to do to relieve my own pain versus having to rely on other people, then go ahead. You can click the link somewhere in the comments and or in the description to submit details of your specific case such that we can see if we can help and apply to work with us personally. All right, let's dive into it. Let's share with you the exact process that we taught to Joey to relieve pain from a disc herniation in his lower back. So again, hopefully you can relate to this. What I would ask is that even though that I'm going to chat about Joey, right, you might have some similarities to him. And so lots of times people come to me and they think that their problem is very special and or unique, but there's so many similarities. So take the concepts that I am going to teach today and apply them to your unique situation. All right, so as you can see, I reviewed this case, and that is part of the process. When we work with people, we have them submit what we call a case review. So this is a case review. I reviewed his case on the 11th of December. I think now it's, I don't know, maybe 10 days later, something like that. So he hasn't been in the program for more than 10 days, but he's totally crushing it. And I know you're going to be able to learn some things from him. Okay, so just a brief background. Let's talk about a little bit of a history so you kind of have some context to understand where he was at, what he was struggling with, to see if it might maybe match and or resonate with some of your experience. Okay, so again, his name is Joey. He is a younger male. He has this low back and sciatica pain. He says 1 month and 10 days, but actually he had an MRI back in 2022 when he had a flare-up of these symptoms, and it showed this L4, L5, and L5S1, the most common levels of a disc herniation, or in this case, I should say protrusion. And so he had disc issues in his lower back, very common, especially for this age group, younger folks, all right? And went to a couple different doctors. They all agreed upon the source of his pain. He has some good days and bad days. By the way, if you're watching this and you're like, hey, I wonder if I'm fixable. I wonder if I can be helped, even if you've tried lots of different things. If you have good days, and you have bad days, right, and your symptoms are variable, then that tells us that the problem is solvable. We just need to figure out what is it that causes the good days and or what is it that causes the bad days, right? So at the end of the day, again, if you're having some what we call intermittency and or ups and downs within the symptoms that you're experiencing, it's a very good sign that we can help. And so this is why we were sold that we could help Joey. Right. We also ask them some other questions like, hey, do you have delayed symptoms? It's very common for folks who we work with to sort of be confused by this. Hey, I'm doing something in the moment, but I don't hurt until later. What does that mean? Doctors seem confused. This is not really confusing. This is actually something we ask about, right? So symptoms are delayed. So maybe when he's doing something, he might have some symptoms, but maybe symptoms are worse later. And he sort of mentioned that. The symptoms do not shift around. Symptoms are always in the same side, same spot, back and butt and leg. All right. He does notice some weakness, so we ask about weakness. If you have some type of L5 nerve issue, then oftentimes you will not be able to walk on your heels. So if you try to walk on your heels, that represents your toes being pulled up, right? You might notice that one foot feels a little bit weaker than the other. All right, so we do screen for that, and he did have some weakness, it seems like, in the one leg. All right, and then we have people do calf raises. So again, this is kind of testing for an L5 issue. This is testing more for an S1 nerve issue. L5, S1 disc issue might cause a problem with this nerve and the function of it. So we have people do calf raises, and I said, hey, can you go up on your toes on one side, one at a time, and then go up on your toes on the other side? And he seems to have no problem there. All right. So if anything, we've got an L5 nerve issue here, which makes sense based off his sort of diagnosis. Potentially a disc protrusion at the L4, L5 is irritating and or causing some type of compression of his L5 nerve. All right. So that's that. No loss of bowel or bladder. That is not a great sign. So if you're having loss of bowel or bladder control and you're watching this, definitely want to get that checked out. That is one indication for MRI and potential surgical solution. All right, no history of cancer, so healthy otherwise. Does mention some sort of struggles with mental health, anxiety, depression, tried acupuncture, tried his own exercises, back hygiene stuff, yoga, Stuart McGill back hygiene things, core strengthening, again, along the routes of Stuart McGill, big three, other things like that. And just really wasn't getting the results long term that he was looking for. All right, pretty big impact. Problem sleeping, loss of focus, anxiety. I think everybody watching this can relate to that. Can't go to the gym and train. That's sort of a nice stress reliever for him. And difficulty sitting, very common. So trouble sitting, trouble sleeping, and trouble living the life that he wants. All right, so this is the background. All right, so this is the history of Joey. So, are there any similarities there? It's okay if there aren't, but take the concepts I'm about to share about how we solve this, and let's move forward with applying them to your unique situation. Let's scroll down. Joey, just 10 days into the program, posted this. I have folks, as they work through the process of learning what they need to do to fix themselves, post a little bit of a checkpoint as they work through understanding the pain relief process. So it's what did he get? What are any roadblocks or challenges? And then what actions is he taking? And so this is what you're really going to want to key in on. All right. So I'm going to share everything. He shares his entire process. Super sharp dude. He gets the concept that we're trying to teach him. Right. He's picking up what we're putting down, and I hope that you can too. All right. So let's read through this line by line. I understand that for every complex movement during my day-to-day activities, we can decompose them into basic motions. All right. Forward, backward, left, right, etc. Then we can analyze which simple movements cause pain and start tweaking the complex movements. All right, so let's just talk about that. That is one like massive nugget. You say, what the heck does that mean, Charlie? Well, let me explain. All right, so life is motion. All right, and so life is usually complex integrated motions: running, driving, bending, lifting, playing with our kids, right? Gardening, all these things. We often don't see these things as individual motions, right? But they are. They're just individual motions strung together. All right, so for example, if you take the act of sitting, which is a problem for him, and we talked about that earlier. All right, well, what is sitting? So if I draw this, there is sitting, right? That's somebody sitting in stick figure form. All right, so there's his nose, there's his eyes. All right, but what are the individual motions that make up someone's ability to sit? All right, sitting is seen as like this, position overall, but we start to break these things down, and they start to help people kind of understand why they feel what they feel. We call this process morphing motion. So what we have people do, all right, is we have them go through what we call a total body scan. And you can see here, we actually send people like a way to track progress and to kind of measure what's happening, because you can't manage what you don't measure. And in this case, Joey had the most trouble with 3 big motions. We have people go through 12 different motions, but 3 big motions. So he had trouble with a forward bend center, a leg raise on the left side, and a figure 4 left. So his back button leg stuff on the left side. And so why do we care about those individual motions? Well, we care about those individual motions because those individual motions show up in his inability to do things in life. So if life, these things right here, is motion, these things right here, then we know that if we can free up his ability to forward bend center, leg raise on the left, figure 4 on the left, then we can allow him to drive and sit and do what he needs to do. All right, so again, if we go back to this picture, hey, Charlie, I'm having trouble sitting. Well, I can tell you, if you're having trouble sitting, then you're going to have a yucky knee to chest. You're probably going to have a yucky figure 4. And what is a figure 4? It's kind of where you put, you rotate your leg, you put your ankle up on your knee, if you can see me here. All right, this kind of motion. That's kind of a knee to chest combined. And so you're going to have a yucky knee to chest, probably, if you have trouble sitting. And if you have trouble driving, well, if we add a leg to this, then do you see the leg raise? That's the leg raise. That's your ability to kick your leg out and straighten it, right? And so when we have people go through an assessment, when you move your own body and you notice that certain motions are what we call yucky motions or problematic motions, forward bend center in this case, leg raise left. By the way, sitting is also a little bit of a forward bend. Basically, you got the knee to chest and you've got the trunk, right? And they kind of both bring you in this acute trunk angle. That's what we would call it, all right? They kind of put you into this V or this C shape. The opposite would obviously be bending backwards of this. When you find yucky motions, realize that these motions are going to show up in the activities that you're struggling with in life. All right, and so that's what he said in that first little sentence. We can analyze which simple movements or which kind of isolated movements, the knee to chest, the figure four, the leg raises, we can find what's yucky, and then they show up in certain activities that we call life, right? Running, lifting, bending, and then we can start changing those things. And so you want to ask yourself, how are my yucky motions showing up in life? You know, if he's got a yucky leg raise on the left side, and then he goes and he's going to PT and he's doing a hamstring stretch, right, with the rope, well, guess what that is? It's a yucky leg raise. Can you see how that probably would not be conducive to healing? He's just multiplying his yuckiness over and over again. And again, like we talked about above, can you see how he would have trouble driving? Can you see how, until that yucky leg raise is fixed, that's someone running? Can you see that running is a bit of a leg raise? Can you imagine that sitting like this, trying to kayak, or trying to do yoga, or trying to do something else, or better yet, trying to bend over to pick something up, is, in and of itself, a leg raise? And so I love stick figures because you can take these individual motions, you can draw a stick figure of them, if you will, and then start to play with things. Start to say, what is that? What is that leg raise that I have trouble doing? Oh, well, it's me sitting with my legs straight. No wonder I can't do that. It's me running. It's me doing a hamstring stretch. It's you know, a deadlift, whatever it is. And so the key then is to free up the leg raise, because we know that if we can free up the leg raise, if we can free up these other yucky motions that are kind of mostly moving him in a forward position, leg raise, figure fours, forward bends, then we will improve his ability to sit and drive. And so then the game becomes not improving his disc herniation. Notice we didn't talk about fixing his disc herniation. We talked about treating his pain experience. We translated his medical diagnosis from this protrusion, which is big, ugly, and scary, and he doesn't really have the power to fix it because it lives on an MRI. And we said, okay, well, how is that showing up for you? Well, how can we translate it into a movement diagnosis? Well, Charlie, when I do these things, they feel really yucky. And then how are these individual things showing up in my life? How are they showing up in more complex movements or activities? How are they disguised? Running, like I said below, is a leg raise on the right side. Also a leg raise on the other side when your left leg's going, right? It's a kick back on one leg with your one leg back, or when it goes back. It's probably a trunk twist right and a trunk twist left. And so if you have any of these individual motions which are yucky, the chance you're going to be able to run pain-free and get back to full speed are not good. All right. So at the end of the day, recognize that that is the first step and the first nugget that he pulled out of the process. He analyzed, he kind of decomposed these things that he was having trouble with. He realized that you could take these individual motions, these basic motions. He understood they show up in life, more complex movements or activities. And then he started to kind of change the way he was doing things. And we'll talk about that down here in a moment. Okay, so then he said, we use the rule of opposites to discover yummy motions and apply them to the healing process. We use the rule of opposites to discover yummy motions and apply them to the healing process. What does he mean by that? Here's what he means. Here are his yucky motions. Forward bend center, leg raise left, figure four left. He took these motions and he applied something that we call the law of polarity to solve the issue. Now, whoa, Charlie, that's some big words. Where are we going here? Law of polarity, law of opposites. Everything has an opposite. And you can often use the opposite of that which is yucky, in this case, so yummy. What is the opposite of yucky? Yummy. To fix the yucky. All right. So to be clear, think of it like this. What's the saying? Righty, tighty. Lefty, fill it in. Lefty, loosey. I think that's how you spell loosey. Right? And so if you're turning a screw to the right and it's not working, it's getting more tight, and that's not your intent. You actually want to loosen it. What do? Well, if right made it tight, And what's the opposite of right? Left. What's the opposite of tight? Loose. So basic logic makes us just turn it that way. And we can apply the same concept to healing. Right? And so if we think about what his forward or his yucky motions are, so forward bend center, kind of he's bending down towards the ground, right? Kind of touching the floor, doing a leg raise left. And he's doing this figure four where he's sitting there. It's gonna be a bad drawing. Figure four left. Or he's maybe putting his leg up on his knee. Kind of like you're trying to like cut your toenails or put your socks on or something like that. Figure four. All right, and so can you see that most of these motions bring his body in kind of the forward direction? This one's a little hard to see because I did it on from a front on, all right? So, law of polarity. Everything has an opposite. If forward equals yucky, then, notice the hypothesis. Doesn't mean it always works out like this, but notice the hypothesis. Then, blank equals yummy. Where would you go from here? Remember, you're watching this. Apply what I'm trying to teach you. Maybe it's not forward that's yucky. Maybe it's backwards is yucky. Maybe it's turning to the right. Maybe it's turning to the left. Maybe you found that hopping on the right leg makes you worse. What is the opposite of that? If forward equals yucky, then blank equals yummy. So we think about sort of the cardinal directions. The body can go forward, backwards. It can go right. It can go left. So we'll go forward, backwards, right, left, and they can twist. You can twist right and twist left. And you only got so many options. If the forward equals yucky, then, I think you already get the answer, backwards, will that equal yummy? Now again, it's a hypothesis. There's a question at the end. But if you've unscrewed something, a light bulb or a screw itself, and you get the idea of righty-tighty, lefty-loosey, and you get opposite results by using this law of polarity, this law of opposites, if you will, then you can apply the same thing to healing. This doesn't have to be rocket science, but it requires testing and a process, all right, and an open mind. It can't be that simple, Charlie. Well, after dealing with this for, well over a year now, and now having another flare-up in the past, month and a half or so, that's what he did. So he said, if forward equals yucky, will backwards equal yummy? And so he started to discover that moving his body in a backwards direction worked really, really well. All right, so let's revisit things here. So we talked about this, all right, this idea of life equals motion, right, and what I call morphing motions. This idea that your yucky motions show up in everyday life. And how is that happening? You need to do some detective work. It's usually habits, routines, things you don't know. Then you use this rule of opposites, right? Or this idea of like law of polarity. Everything has an opposite and can use the opposite to fix and balance things out. Roadblock. I actually made a lot of progress since I discovered which movement made me feel better. The positive results I got this week are amazing. This phase showed me the mindset to reduce pain in my daily activities that generated pain. We'll talk about this in a moment because the mindset is something we touch on. Let's talk about driving, right? Driving kind of goes back to this idea of like how, remember I said this, how are your yucky motions showing up in life? Obviously, has trouble driving, right? And sleeping and things like that. Driving, I fixed it as much as I could by using a pillow between my back and the seat, adjusting the seat distance to the pedals, and twisting my body a little bit into a comfortable position. So he followed yummy, and he leaned into something that felt good. But this makes sense if you think about it. So he used a pillow between his back and the seat. So what did he do? He went from driving like this to driving more like this, to one leg down. And then, add this in, he adjusted the seat distance to the pedals and twisted his body a little bit. So instead of his leg being, say, this outstretched, had to reach for the pedals, he realized that that yucky motion, that left leg raise, which is really yucky, is maybe showing up in the way I position myself when I drive. Driving a manual transmission, that's a yucky left leg raise over and over again. Right? And so, what if I bring my seat closer, not forever, and my leg isn't as stretched out? Well, you start to reduce the leg raise. Right? And how did he get to that? How did he start to think about this? Was it blind luck? No, it made sense. I've got a yucky left leg raise. I've got a yucky forward bend. And so if I can get myself out of this forward bend or reduce that forward bend, open that hip trunk angle by putting something behind my back and making sure that I don't lean forward in the seat. And if I can bring my seat closer, then I reduce also the leg raise. So I'm essentially eliminating these things. And well, it's kind of hard to do a figure 4 when you're in the car. All right. And so he did what we call tweaked these activities to find as much comfort as possible. All right. But it wasn't a surprise. You can see how everything here makes sense. It's not we're just randomly trying things. It's like, hey, once we go through a self-assessment, we identify what's yucky. Then you can start to say, how are those things showing up in life? Okay. And then how can I start to tweak those things, knowing that and getting that there's a clear pattern there, and hopefully you can start to see the pattern. And how can I find more comfort? How can I start to calm things down, stop aggravating or picking the scab? Now, sleeping. Sleeping is actually the first thing. If you're having trouble sleeping, we've got to improve that first, because there's clear evidence that shows that people who have trouble sleeping, well, they just don't heal very well. All right. And so at the end of the day, there's a clear link again between the quality of sleep and the amount of pain you experience. So we've got to improve sleep right away. It's the first thing we recommend if you're having trouble doing. Driving, we can fix, whenever. But if you're not sleeping well, probably ain't going to be able to drive very well, and probably not going to heal very well. Okay. So he's still changing it, but now he can sleep without pills, and he doesn't have to wake with pain most of the days. So he's heading in the right direction again, just 10 days into the process. I put a towel behind my back to generate a curve, and I notice I wake up feeling much better. Sometimes I get too confident and just lay normal. Next day I'm a little bit stiff. This is totally cool as well, because what does this tell you? Does this make sense? And your answer should be, heck yes, Charlie, it totally makes sense. Now, it's okay if you're not making sense of this yet, but let me explain. So we just talked about his yucky motions. All right, his yucky motions, forward bend, leg raise, right? Again, these kind of C-shaped motions. And so oftentimes what happens is you've got your mattress, and here's what he was doing before. Kind of just sleeping in it, right? And if you've had your mattress for more than, I don't know, a couple years, something like that, right? It might be a little bit softer, or maybe you just prefer a soft mattress. Again, soft mattress is not good nor bad, but he finds that, hey, when I sleep, or when I used to sleep this way, Charlie, I would have stiffness and pain waking up. I would have problems getting to sleep, and I would wake up in the middle of the night and wake up in the morning with more pain and stiffness. But why? Well, if you look at this, again, I exaggerated a little bit, sort of like a hammock shape of the body. What did he say he just did? What he did is he said, hey, here's my mattress. What I did, Charlie, is really bad drawing, but you get the idea. I put a towel roll behind my lower back such that it puts him in a little bit more of an arch. Why does that make sense? Well, if this is yucky, if forward or slouchy makes him yucky, then backwards, or some extension we call it, might make him feel yummy. Now, it was just a test. Again, these all have question marks at the end of these statements, but guess what? It worked. Now, again, that's not a surprise. Why is it not a surprise? I would expect that if he's putting himself more in that forward, he's not completely there, but if he's moving himself towards that yuckiness, that it would bother him more. And therefore, I might make a hypothesis that if we can put his back in a little bit of an arch versus this, just the opposites again, law of polarity, nothing crazy. Notice I didn't mention anything about the L5, S1, disc, L4, L5, disc herniation. We're not treating that. We're treating movement pain relationship, positional pain relationships, and the pain experience. When he moves like this, much better. When he moves like this, worse. And again, that makes sense because these are his yucky motions. And that's how that yucky motion, that forward motion, is showing up when he sleeps. And when he reverses it, guess what? He gets the opposite result. Less stiffness, less pain. Sitting. Well, we know he has sitting, and we know now why he is sleeping, and we know also why he has driving. There's a link between all these. Driving, sleeping, sitting. Again, kind of sleeping, he's in that hammock position, forward motion. Driving, he's in that leg raise. That's yucky. Sitting, he's in kind of that kneaded chest figure 4 motion and a forward bend. Of course, they're going to be yucky. It just makes sense. So this is one of the biggest, pieces of progress, if you will, or areas of progress. Has trouble sitting at work, kind of a problem. Since I discovered that backwards to the left felt good, there it is, he tells you, right? Backwards to the left felt good, I started doing it like a quick exercise. So here's the coolest thing, all right? Because he gets the process, and he went through the process. First things first, he optimized the healing environment. He learned to self-assess, he learned to go through some different motions, and he highlighted those things that were yucky. He started to then ask himself, how are those things showing up in life? Well, it makes sense that I can't drive, that I can't sit, right? Those are those yucky motions, and I can't sleep like that. And then he started to tweak things. He started to change things. When he drives, he puts his back in a little bit of an arch. Remember, he put the towel behind his back. He feels a little better. When he sleeps, and he puts a little bit of arch in the back, he feels better. And so then what he said is like, that's very interesting. Tweaks drop clues like cookies drop crumbs. Try to say that 10 times fast. Tweaks, or the ways that you modify activities, if you can find things that make you feel better and or worse in the way that you're sitting or bending or lifting or sleeping. If you can change it in some way and you say, wow, that definitely helped, then the next step, right, is to say, or how can I turn these tweaks into exercises? If tweaks drop clues like cookies drop crumbs, then what is this clue telling me? That's weird. When I sit like this, it feels much better. When I sit like this, it feels much better, right? And when I lay like this with my lower back, it feels much better. And the opposite of all those things, or bends, leg raises, that's a leg raise. Oh my gosh, that's terrible. All these different things, they make me feel worse. And so if these are the things that make me feel better, this and this, how could I bottle up that concept of what that tweak is trying to do, or the way that that tweak is moving my body? In this case, it's pushing him closer to backwards, which totally makes sense again, because remember, law of polarity, forward is yucky, backwards might be yummy. He just found that going backwards to the left was the yummiest through different testing that we did with him. And he said, that totally makes sense. And so how can I turn that tweak into an exercise? How can I bottle it up? This is a pill bottle, believe it or not. Here we go. How can I bottle up the concept of that which the tweak is trying to accomplish, which is move my body backwards? That seems to feel better. And how could I make that into an exercise? How could I turn that tweak into an exercise? And what he did is he started doing it like a quick exercise. And he realized that it calms down his left leg from sciatica almost to zero. And so he started applying it while sitting, since the nerve started to get a bit angry. At first, the motion was exaggerated. He was really pushing into it. And then he realized if he just does it a little bit, it doesn't need much. It's much more effective and precise. Notice how he's open to testing things, not just saying, what do I do? But teach me the concepts, Charlie. Teach me how to fish, and then I'll be able to handle any fish that gets on the rod. And that's what we're really trying to do for people. And so he started applying it. Let's talk about the application of this. And so this tweak, that could turn into a little bit of a, if there's a pill in here, a little bit of a backward bend. And he just found that doing it back to the left felt better than the right. So he stuck with only the left. And so on this pill bottle, it says backward bend left. If you went to the movement pharmacy, this is what we handed him to go home with. On any medicine that you receive, there's a prescription. And what does the prescription have on it? I've broken it down into 3 elements, and this is how you can think of applying movement. You can apply this to movement and use movement as medicine. So there's a dose, which is essentially how much. There's a frequency, how often. And then there's timing. Most people don't think about this when it comes to movement. When, right? So if this was Advil, take 200 milligrams twice a day in the morning after you've drinking milk. I don't know, I'm just saying, right? Or after meals, right? And so dose, frequency, and timing. And so now we've got this little back bend move that he does in sitting. Repetitive little back bend, not a big one, but a little bit of a back bend. And now we start to play with the optimal prescription. So you see how the movement was born. You see how he got to that. You see the logic through which he thought to get there and how we taught him to get there. And then dose, how much? I'm going to do this 15 reps. So we're doing it for 15 reps. How often? At least 3 times a day. But more importantly, this is a little bit of a generic prescription, but more importantly, when does he do it? When would you do it? Would you do it just randomly, morning, afternoon, and night? You would do it when you knew that symptoms were going to be highest, right? So basically, you could say as needed, or if you're in medicine, PRN, right? But the idea is this. Let's just say that this is pain and this is time. In the morning hours, he's not working much, and then he sits a bunch in the afternoon. You know, if this is lunch. Well, when would he do his exercises? Would he do his little back bends right here and right here and right here and be done with this 3 times a day? No, it wouldn't make any sense. Instead, he times it like you would time any medicine right before the symptoms are going to start, or before you would expect them to start, or just as soon as you notice them. So he does them here, and then maybe he does them here, and he does them here. And guess what? When he does that, now symptoms don't come on nearly as bad. And you multiply that medicine You find sort of that therapeutic dose, if you will. You multiply that, and he's just multiplying it daily. So now he found not a sheet of exercises that work for him. That's never the goal. He found a motion that, upon testing systematically and scientifically, reduces his symptoms, makes him feel better. He applied the concept. Okay, when I change the way that I move in this way, it feels better. That's how he came up with this motion idea. He tested it, it worked, and then he put it inside of a pill bottle, slapped a prescription on it, started taking that movement as medicine at a certain dose, at a certain frequency, and started timing it when most appropriate. And now 10 days into the program, doing much, much better. Pain relief is, he's moving in the right direction, right? So amazing results within just 10 days. All right, and so one last thing we didn't touch on. I know I'm scrolling a bunch here because my mind's going kind of crazy. So this phase showed me the mindset to reduce pain in my daily activities that generate pain. So remember we talked about how, he has a history of some anxiety and things like that. And by the way, like when you're in pain, you tend to go a little bit insane. There's lack of clarity about what to do, and often frustration and fear and worry and what ifs and all that. And so that's very normal. But at the end of the day, we teach people that pain is more than just a physical entity for most people. Now, in his case, right, you could say, well, he has proof of those disc herniations. Absolutely right. But if you think about it, this is the pain experience, all right? There's a mind or a brain component, and there's a body component. So what happened? Right? Maybe he was in the gym or doing something, right? And started to notice pain. Injured something in his body, maybe protruded or herniated disc. And then when you move your body in certain ways, what do you say to yourself? What do you reinforce? What are you thinking? I'm thinking, ooh, movement equals bad or pain. And then does your body move more or less? Decrease movement in the body, and then increase fear in the mind, or worry or concern, right? And so you can see how pain starts for whatever reason. In this case, maybe an injury, disc herniation, less movement because movement equals pain, avoidance, worry, concern, less movement, more fear, less movement, more fear, less movement, more fear. And so you start to train yourself to be avoidant of different things. You start to learn as you're looking online that, oh, you need to have a neutral spine. You need to activate your core. And all these things do is reinforce that you should be avoidant of moving your body in certain ways. They all reinforce that you're broken in some way, shape, or form, and you need to be more protective. Now, in the early phase, it might make sense. But as you can imagine, the longer you hold your core tight, the longer you're in this neutral spine, the longer you avoid certain activities beyond a certain point, again, the more you reinforce that movement is bad, and the more you reinforce the pain that you're experiencing as something that's dangerous. Right? You should teach yourself or train yourself to live in pain. And so the mindset here is really important. If pain is a dangerous signal, then what can we do to reduce the fear, the concern, the worry, and the anxiety around it? Well, part of reduction in that is having a process. Right? If you have a process that says, hey, phase 1, phase 2, phase 3, phase 4, step 1, step 2, step 3, step 4, do this, Joey, then do this, then do this, then do this, and a process that's working for thousands of people with back, butt, sciatica problems, then, well, right away, you probably feel less fear, worry, concern about will this work or will this not work, because you have clear steps outlined in front of you. All right, so at the end of the day, the mindset, if you will, if you want to call it that, for lack of better terms, is very important when it comes to reducing pain. The other thing here is you can see that Joey's willing to experiment with many different things. He doesn't accept anything as an absolute, and he's creative in the way that he applies these concepts. Some people struggle to get better because, when they get to using certain motions, this movement is medicine phase, what they'll do is they'll use exercise or movement as a weapon, not a tool. And this is like a little bit of a nuanced point, all right? Use movement as a tool, not a weapon. Some people use movement as a weapon, not a tool. And so what do we use weapons for? We use weapons to destroy things, to fend things off, to fight things. We use tools to help accomplish something. Do you see this slight difference? And so if Joey were to use movement from a place of, oh my gosh, I noticed symptoms. I've got to try to bend my back. Oh my gosh, is it going to work? Is it not going to work? What if I get this wrong? What if I was told that I have this problem? Maybe back bends are bad, and so should I do it? It feels good, but should I do it? Should I not do it? Oh well, I was told that I should be in a neutral spine and I should keep my core tight all the time. And so is that okay? Is that not okay? And so you can see that if he were to come from using movement as medicine, from a place of being someone who's fearful, worried, concerned, lack, I've got to get rid of this thing or else, then he's reinforcing that thing which he's trying to get rid of or fight off as something as dangerous. And so if you're doing anything right now to try to solve your back butt sciatica problem, herniated disc, spinal stenosis, piriformis syndrome, sciatica, could be many things. And you're being someone who's doing things, be, do, be, do. You're being someone who's doing things from a place of fear, lack, frustration, anger, to fight things off or to flee from the pain, then you're going to have more pain. Right? It just makes sense psychologically. You don't try to fight off something which you are okay with, something that you are indifferent to. Instead, you try to embrace that thing. And this is why rest backfires on people so many times. I'll just avoid. I'll do meditation. I'll try to breathe through the pain. I'll try to let it go. The more you try to let something go, and the more you tell yourself that you have to let something go, again, the more you reinforce the danger inherent within that thing which you're trying to let go. In this case, the pain experience. All right. So be careful not to use whatever intervention you're doing as a weapon, but consider it as a tool. And so if you can stay curious and playful, not be too hard on yourself, reduce the pressure, be open to testing different things, exploring different belief systems. Hey, maybe in this case, he did have a disc herniation, and everyone says, oh, well, disc herniations, they love bending backwards, but sometimes they don't. And so if you're watching this, you're trying lots of press ups, for example, doing, what other people would recommend, and it's not working, then consider that maybe you actually need to move your body forwards. And so again, this is why I didn't mention much about treating the diagnosis. Instead, we translated that medical diagnosis into a movement diagnosis. How do we do that? Step one is we translated medical to movement. How do we do that? What I call a total body scan. We had him go through different motions. So you yourself could move your body in different ways, or maybe you have some data for moving your body or from having another PT or another chiro or someone else move your body, and they found certain things that were a bit yucky. Now, instead of it being an L5, S1 disc problem, which we have to fix, how good are you at fixing a disc herniation in your spine? You'd probably say, well, I don't know, I had to look up even what the MRI report said. Well, then don't do that. It doesn't make sense to you. Why not translate it into something you can see, feel, and experience? A movement diagnosis by moving your body in certain ways, right? And experiencing those things which feel yucky. And then by default, you're going to find some things that feel yummy, right? And you may be able to use those yummy things as Joey did to fix yucky. Watch this again, meaning slow this down and watch this video again if you need it. All right. And so now instead of trying to fix the L5 S1, we're trying to fix a yucky leg raise or a yucky forward bend. And that's it. Much simpler. Do you think that we can maybe do some things to fix those motions? Because we know, next step, morphing motions. How are these, which answers the question of how are these things showing up in life? Well, we're going to have trouble driving and sitting. And in this case, he had trouble sleeping. And that totally makes sense, Charlie. Now what we can do is we can tweak things or change things. And then, oh, those tweaks or changes, is there something consistent about the way I change the way that I sit or bend or lift or twist or sleep or whatever that seems to be valuable? If yes, how can I turn that thing into a movement that I can use as medicine, right? And then optimize the movement prescription, dose, frequency, and timing. And then how can I just take that one medicine, notice the one medicine, whole sheet of exercise if you're doing that right now. I don't know how you're going to learn what's helping or what's not helping. So the goal is that we find one motion, in this case for Joey, that works and works immediately in the moment. Notice he didn't say, hey, I had to try this thing for like years, for months. Hey, I found immediately it changed the symptoms that I experienced. Awesome. That in motion form becomes a mini back bend. He slapped a label on it, and then he just multiplied it over and over and over again. And this is an iterative process. You might have to change it at some point and go back and reevaluate things. Or you can track how well these motions are doing over time. Again, keeping the right mindset, not being someone who's fearful or scared or worried or concerned. It's hard to be creative when you're in that zone. But he's being someone who's curious and playful and he's doing things, B, doing things with the intent of collecting data, not necessarily getting out of pain, just following a process. And then guess what? He's having a great experience and he's resolving his pain. So he has the right mindset, the right attitude, and then he follows a process. And that is that. All right. So look, hope this is helpful. I know a long video, but I tend to go pretty in depth with things. I just wanted to outline my sort of logic and or decision-making framework for helping someone, in this case, like Joey, who might have a disc issue. But again, it's less about the disc issue and it's more about the pain experience. How is that showing up for you? Movement diagnosis, what things make you feel better, what things make you feel worse, right? Also treating the psychology of pain, understanding that pain is a danger signal. And if you're willing to be open to the idea, the mind can absolutely influence the pain you experience, because it can. It's sort of the CEO. It determines actually pretty much all the pain that you experience. Then at the end of the day, right, that you can treat not only the mind and the body, or the body and the mind, however you want to think of it, right, but you can sort of break free from this negative feedback loop, this negative pain, sort of frustration cycle or loop. All right. And in doing so, most people can solve these problems naturally. All right, so hopefully this is useful. Maybe in the comments below this video, if you found it valuable, just let me know, and maybe give me some takeaways, right? So if you're watching this, you're like, hey, Charlie, great idea. I can actually do this, or I can try this, right? At the end of the day, if you're watching this and you're like, hey, I would like to get some help like Joey, because Charlie, you just banged through that really quick. Now, I realize the video is pretty long, but like I can see your wheels turning and you get the process and you have a process that's worked for so many people. Yes, I'm a specialist in helping people with back, butt, and sciatica problem. So the best first step would actually be to submit this case review or something very similar and apply to work with us. The reason that we have people submit a case review is because if you're watching this, well, we don't actually know if we can help. Hopefully it sounds reasonable, because we just don't know who you are. There's lots of people going to be watching this video. And so if you're interested in sort of getting a fast track like Joey was to relief, then just click the link somewhere below, again, in the pinned comments and or description. Click the apply link, basically set up a brief time to chat and submit details of your specific case. We call it, again, a formal case review. Gives me, it's even more detailed than this, but gives me all the questions that I need to confirm whether or not we can help, also to rule in or rule out some other things that we might want to take a look at. I review all cases personally. If at any point I don't feel like we can help, well, then we just give you a call. I just give you a call and or I shoot you a personal email with other recommendations. All right. So hopefully that sounds fair. Again, if you're looking for help like Joe and you found this useful, let me know what you found valuable in the comments, and then click the link to apply to work with us and submit a detailed case review so that I can review things personally and confirm whether or not we can help. So that's all I got. Thanks so much, everyone. Hopefully this was helpful. Bye.